And action! Allie had a question about CBT, cognitive behavioral therapy. And this is a tough thing to teach. In fact, a patient of mine told me that she didn't get what I was talking about when I mentioned we have to incorporate mindful practice. But she gets it now, which is really cool. It is hard to impart with just one visit or a video what CBT is or how to change core beliefs. So hopefully, Allie, this will give you a little bit of an idea of what going to behavioral health, a psychologist, would be useful for. The majority of people feel very apprehensive about going to a psychologist or a psychiatrist. I think they still have, that behavioral health field still has a name or a tag on it, so there's a sense of weakness or vulnerability when you have to go to somebody like that. Kind of like an athlete coming to me and I say, you have some weakness, or I see this as a little bit of a weak link. Tell that to a world-class athlete, he'll be like, what? Who is this guy? Right? So it is okay, it's normal to say, I don't want to go there, or it's kind of uncomfortable, I don't think I want to go to a psychologist. But think of it this way. When I have patients make lifestyle changes, whether it's to go from neutral to outstanding and bulletproof, or to go from suffering to neutral, there has to be accountability. Whether it's nutrition, or it's activity, or it's mindful practice. There has to be accountability, and if you don't have training from before, then it's going to be hard to rustle up a change on your own, if that makes sense. If I have never done a marathon, and I have been told you have to do the marathon in Chicago in October, and I just wait till the last minute, what's going to happen to me when I run the marathon? I'm going to get hurt. Which is actually what happened to me. I didn't train. I just kind of see if yoga would take me through 26 miles, and it kind of took me through 13. I hit the wall, had IT band syndrome. But anyway, so the idea is I should have got a coach to show me how to run and to help me ramp up, maybe even join a group to help me be accountable to my training so I can participate better and come out the other end symptom-free. But I got hurt. Now, in bigger aspects in the world, the big diseases that come at middle age, 40s, 50s, are usually heart attack, stroke, or cancer. Now, if you want to wait till the last minute and take your chances on having one of the three pop up, that's okay. Somebody's going to be around to help. I'll certainly be around, and I'll probably be able to guide you, and you can be accountable to me. But I tell you what, if you have those three big diagnoses in full-blown presentation, it will be much harder to reverse. So if we can kind of see that beforehand, see the event before it unfolds, then your accountability and your coaches can kind of mold it so it's much easier to take care of. And this is where cognitive behavioral therapy comes in handy, that mindfulness thing I talked about with a patient of mine. Most of us have this set of core beliefs when we're, say, in grade school and then in high school. We have a couple of core beliefs that we learn from interactions with our parents, with our peers, and with our teachers that gets us through grade school and high school. And there's a lot of things that happen at that time of our lives. And usually those core beliefs, we will carry them into college and getting married, dating and getting married. Sometimes the core beliefs, they might change a little bit. Sometimes the core beliefs don't change and they're rock solid. And that's where the problem sometimes happens is if you come up with the changes of life, going from school age years to dating and marriage, there's other challenges that pop up. And even from dating and marriage to midlife to elderly age, there are different challenges that happen at the decades of life. And if you don't have flexibility to learn, if you don't have a psychologist that'll teach you about changing your core beliefs and your thoughts, then sometimes the old-fashioned stuff they're used to will not help you make it through that next decade of challenge. So the problem will be either manifesting as depression, manifesting as anxiety, or manifesting as some other mind-body problem. There's something called conversion disorder even. Sometimes conversion disorder, I'll have a lot of patients who have fibromyalgia, have chronic pain, have trigger points, have these weird symptoms that we either blame on Lyme disease or fibromyalgia, some rheumatologic disorder, some food allergy. You all know who you are. All the specialists in the world will say, well, it's not really this, not really that, go to another specialist. And yet, we still are suffering. So sometimes, I'm not going to say it all the time, but sometimes it comes down to changing around that way we think. Because it might be manifesting as palpitations, might be manifesting as irritable bowel syndrome, might be manifesting as headaches, might be manifesting as numbness and tingling, weird vision changes, weakness with activities of daily living. So it's not always, but only in America do we say that the mind is separate from the body. In the ancient healing traditions of China and Ayurveda, yoga, India, American Indians, South Americans, there is no separation between mind, mood, and physicality. It's always one and the same. So there's always going to be the way to take care of the whole person, not just take care of the physicality and have all the, from the neck up, you get taken care of by a behavioral health team. And that's the problem, is when we separate that, it's unfortunate, but it makes, I think, a bad formula for disaster, especially as we hit middle age. And some people, like with Ali, when you're hitting the early ages. So what a good psychologist or counselor can do is work on the way you react to those events in your life. We all, if you have a room full of 10 people and they witness an event, all 10 people will relay the event differently. If the event happens to them, then they'll have their individual interpretations of the event and what it means to them. And that's where your core beliefs will change. Some people will catastrophize. They'll take an event that happened to them and they'll think of the worst possible scenario. In a lot of cases, a lot of people will have irrational thoughts that don't just make sense, but they believe that. And it takes a therapist or a coach, a behavioral coach, to tell you, let's try to work on that, because in truth, it's not really happening. You're not going to die. There's no fire. There's no burglar. There's no boogeyman under the bed. There's no cancer in the chest. So let's work on the way you're thinking about this. Will it change all the symptoms? No, it won't change all the symptoms, but if there is any link, any hint of possibility that these symptoms of suffering are due to conversion disorder, anxiety, or depression, then hey, you didn't even take a medicine, you just worked on core beliefs, you worked on therapy, you had your coach develop a new way of thinking, and what's it going to hurt? It's not like taking a medicine. You don't have to take a medicine at all. You just have to learn a technique. Again, if you do the marathon training on your own, the likelihood is that you're going to have a little bit of a hit-the-wall injury at some point in time, especially if you've never done a marathon before. If you have a lot of suffering in the decade that you're in, and you are using old core beliefs, and you're trying to adapt new core beliefs on your own, how are you supposed to do that unless you're a psychologist? And those guys spend a lot of time in school. I think I spent a lot of time in school. I calculated as my 26th or 27th year of school after finishing the Integrated Medicine Fellowship. I lost count already, but the idea is to always be dynamic with every decade and every milestone of life. So don't feel bad if you have to go to a coach, a mindful coach, but this is part of the process. If you're going to make that lifestyle change from suffering to neutral, or from neutral to bulletproof, you don't necessarily have to have the coach during the entire change or transition, but I think it's nice to be accountable to somebody you can bounce off questions. I have a lot of my patients get on the portal. So they'll be with me pretty frequently when they first meet me. And then as I see that they're making a transitions, I will transition off to my coaches and I'll let them kind of interact and make the nuanced changes. And I see that usually I'm getting into this practice 3rd year now, and I can see patients actually moving away from their coach and actually being able to sustain on their own. And that's beautiful when you see that happen. And when I don't see it happen, it's okay. I'm still here to, again, change the dynamic, not go back to the old tradition of what we used to do. That's like using the same old core beliefs with a new milestone or a new incident of life or a new situation. You want to change that. Same thing if somebody hits the wall with their training for marathon, or they're training for some milestone, marriage, divorce, new baby, some other schooling or education, bankruptcy. When there's challenges like that, you might have to, again, change the way you tolerate, change the way you think, change the way you react. You can't change the situation that you witness, like there are those 10 people, but you can change the thoughts and the belief systems that'll control the way you react. You control the way you react to things, you might just reverse your suffering. So hopefully this is a little tough it's tough whenever we talk about thinking, beliefs, irrational thought, but if you think of it in black and white terms and what I just mentioned as far as milestones, taking the old, applying it to the new, expecting change, you'll probably fare better. So hopefully you do well, Ellie.